My name is Dr. Joe LeMaster. I am the Public Health Officer for Johnson County. The March 22 order calls for stay at home. The idea behind this is that all residents in Johnson County should, as much as possible, stay at home, work at home, starting from Tuesday, March the 24th. This will also give you the ability to access essential services like going to the grocery store, to the doctor, to the pharmacy, and all of those essential businesses that provide those services will continue to stay open. The general problem that we are having that is driving the need to take this additional step is that the amount of transmission which is happening for the disease in the community is very difficult for us to be able to measure accurately with the limitation of testing that we have available. By taking these additional steps, we can both protect our critical care bed capacity and limit the transmission of the disease in our community to reduce the probability that we'll see an excessive number of deaths here. The order calls for this to go on for about 30 days. Within that period of time, it is our very steadfast and committed aim to set up systems of monitoring to determine how we are doing. We'd like to be able to see what's happening to our critical care bed capacity during that time, how much we're using that, as well, if possible, to be able to get more indicators of transmission and how many cases there are in the community. Some of these things are dependent on getting the adequate amount of supplies. Some of them are dependent on getting set up the appropriate data systems. 30 days gives us enough time to get that to happen. If by 30 days from now we're seeing a great increase in the number of people are in the hospital with critical care needs and an increase in the amount of transmission, we likely will have to extend, but we can't say that until we get to that point. There's just so many unknowns between now and then that we still need to wait to see what's going to happen by that point. So you can imagine that if Johnson County had not done the stay-at-home rule and the other counties around us had done it, then what would happen is that people from the other counties might be coming into our county to try and access services or businesses or other types of activities that were not available in their own counties. This would potentially bring those people with perhaps an increased infection risk into our county or the other way around. So it just doesn't make any sense at all to do it on a county by county basis. By doing it together with the other counties, we can have consistency across the metro region and reduces a lot of the confusion that will otherwise have occur, and also reduces the probability of more transmission happening. Absolutely, the parks remain open, the walking trails remain open. We're asking people not to use playground equipment in those parks because of the possibility of people interacting or kids touching all of that playground equipment and other kids coming along afterwards, especially when there's crowding. We're limiting to some degree the capacity in those kind of places, but certainly we want to encourage people to go outside and still get fresh air and still do exercise, but maintain the social distancing policies that we've put in place otherwise. The people that are working in the essential services will continue doing that work. That includes quite a number of businesses in the community. Others should work from home if they possibly can. Though there will be people that are not able to do either of those things. The list of essential services will be in the public health order that is going to be on our website. So you can look there. If you have questions, we have a hotline to be able to call to ask questions about whether that would in fact be the case. the essential services that are available will make it possible for you to continue to live safely in your homes and to be able to get everything that you need. The first thing is don't panic. There is plenty of available resources and supplies for what you need. Second thing is continue to practice the personal hygiene guidelines that we've given before. Washing your hands before and after you eat and after you use the restroom for 20 seconds vigorously. Not touching your face without having washed your hands. Maintaining a 6-foot distance between other people in any situation that you're in as much as possible. All of these things will go a long way towards reducing transmission and are the most important thing to do. The additional thing that we have said before still holds in terms of groups of 10. They're all group meetings or group activities that are larger than 10 should be stopped as much as possible. Even if you're in a situation where you're meeting with others in a group and there are 10 people, the social distancing should be maintained. But as much as possible, all types of group meetings that were happening should go online and start connecting with others through online media, if that's possible, through teleconferencing or whatever. As much as possible, we encourage people to eliminate group meetings wherever they can, so that will help a lot. Stay strong, stay safe, and stay home.